Peace out. Yeah. Oh, there's me. I know me. Oh, look at that. Right off the back, it's Carol. Yeah. You had them right in order. You knew what the way we were going. Right next is Marshall.
Your luck.
If I'd have just grabbed these and went in order, I wouldn't have got his name mixed up with Shane. How embarrassing. That's only the third, second, fourth,
Second.
third.
Call me whatever you want.
I think we'll try to refer to you as the name that you go by. Oh, there you are. Look at that. Just have to think your name that comes up.
I wish I had those powers.
That was beautiful.
Thank you. It's gorgeous up there today. I couldn't believe I came down here to this.
Oh, it's so this is one of those front range
Inversion,
storms.
yeah.
Yep.
It's sunny, at least 5
We got
degrees.
you a real one.
Oh, thank you.
Air fishing. Well, it was a gorgeous night when I came up and met with the council. I hope that was beneficial.
It was very, I think, very well received. and Very thankful for your time, so.
Well, good. That's the goal. Prefer this story. Yeah, I got it from this really cool person.
Because I just left my little car.
You just spend a day with them and you get them. It's a really good one. It stays hot
Yeah,
or cold, whatever you prefer.
yeah.
Of course, then you have that problem where the tea is too hot to drink, right?
Yep.
It does keep it too. Beth and Brian, how are you two?
Not bad. How are you guys doing?
Fantastic.
In.
Oh.
Pretty much everybody.
Yeah, so let me get my.
Can you press out that paper?
Just
You have one? Is that good?
work.
That one?
Yeah.
You got your own?
Thanks.
You got your own?
Yes.
Thank you.
I have a question.
She's the alternate for Loveland, that's Janelle.
Okay. As you can see, names are not my strong suit. I'm coaching a brand new team this year. I was coaching a team from fifth all the way. Now they're freshmen. And last night I'm like questioning every one of their names. So I make them call their each when they pass their name, so then I can hear the names. And I finally got 5 of them. Well, all right. Let's see. We do have a quorum, I believe.
So I should feel honored that you remember.
Yeah. Let's call the meeting to order. It is 2:03. This is the Regional Opioid Abatement Council, Region 2, monthly meeting. We're calling it to order. Before we jump into public comment, I just want to do one housekeeping item, just so we can avoid some confusion. Just members, going over the membership structure. If we all recall, we have the 6 voting members. That's one piece of the structure. They help deliberate and then they make the ultimate vote. And then we have our advisory members, which participate in the deliberation. So important to hear that feedback. We have 1, 2, 3, 4, 5, it's about 9 members there. But they do not vote. Then we have our subject matter experts, which present and provide good feedback, but do not deliberate. So just sometimes there's some confusion, and I don't want folks to feel like they're not part of it or being excluded. So what we're going to do is when there's multiple hands up, we're going to kind of go in that order. If there's a voting member hand up, I'm going to call on them first, advisory member second, subject matter third. Not because we're not wanting to be inclusive and listen to everyone's comments and thoughts, because that's so important, but just so to avoid some confusion. Any feedback or comments with this approach?
Sounds good to me.
Thank you, council member. Okay. Well, with that, let's get started with the agenda. First item on the agenda is public comment. This is an opportunity for someone to provide any public comment to the council. Do we have any public comment?
Counselor Smith?
Okay, no public comments, so we will close that. Okay, item number 3 is approval of the meeting minutes. We have 2 sets of meeting minutes. We have looking for approval minutes from August 24th meeting and the September 28th meeting. Let's just tackle those separately. So the August 24th meeting, do we have a motion?
I'll move to approve. Go ahead.
Second.
All right, we've got a motion from trustee Lungland and we have a second from council member Olson. Further discussion? Seeing none, let's vote. All those in favor indicate by aye.
Aye.
Aye. Any opposed? That passes unanimously. Okay, this next set of meeting minutes for September 28th.
I'll move to approve September 28th meeting minutes.
Second.
We have a motion from Beth and a second from council member Olson. Any further conversation? Seeing none, all those in favor, signal by aye.
Aye.
Any opposed?
I'm abstaining since I wasn't here.
We do have one abstention because councilperson Youngman was not here. Thank you. All right, moving right along. Let's move to item 4. Let's set this up. If you all recall our meeting last month in September, we did some heavy lifting. We had some great conversations and listened to a lot from our advisory members and subject matter experts about adding 2 additional priorities due to the increased funding allocated to Region 2 for year 2. So we've got that in the packet. And Carol, would you like to, we'll put it up on the screen and like to review the funding plan from that, and then what we want to do is have a conversation and then ultimately seek approval of the plan. So we're getting that pulled up for everyone.
So you can also see the plan in your packet. And just to walk through it, the COAC really wants a 2-year plan. So they want us to take our 1-year plan and then the plan you're just working on, and then it'll be a total 2-year plan. So that's why there's this total column. They see it in 2-year chunks, even though we plan in 1-year chunks. So the plan is fairly brief. The first item is the approved uses treatment, and it's criminal justice involved persons. And that is the co-responder program expansion. And the original amount was $550. And in the last meeting, the group talked about using the same amount for the next year. So that's the $550. The next one is the people in treatment and recovery. And that is the grant that goes to North Colorado Health Alliance. And again, it's the same thing, same amount for both 2 years. The next one under treatment is the new one. And the group wanted something they wanted monies to go to housing. So 50% of the unallocated money would go to housing. And that's what this represents. Tom and I looked through the list of approved uses that the COAC had provided, and we found this one that seemed to fit pretty well. It covers a lot of issues, but it does specifically talk about supportive housing. I think that's really the main thing that we picked out. So we thought that seemed like the right category for the housing. And then under prevention, the first one is the school-based programs, and that is the CSU grant. And again, right now it's the same amount. And then the next one is another new use that the council was interested in. And that has to do with increasing social connection. And for this particular use, there wasn't anything in the predetermined list that fit. So Tom came up with the wording for this one. The last one under prevention is overdose deaths and other harms. And this is the grant to Northern Colorado Health Network. And again, it's the same amount for both years. And then we get down to the administrative costs, which are 10% of the total for both years. And I did want to note one thing in the administrative costs. When we did the plan originally, we put in some wording about what those costs would cover. But since then, a couple of new potential uses have come up that would be good for us to add, I think. One is the conference attendance and scholarships. And the second is stipends for council members with lived experience. And the group hasn't voted or taken any action on that yet. But my thinking was if we put it in there, if we do decide to do it, then it would already be approved. So between the two of these columns, that covers the total amount of the council's allocation, the total of available funding, which is about 2 million for the first year and 3.4 million for the second year. So any questions, comments?
I just want to make sure that we're noted in the minutes that we're here. Sorry, we were across the street and we were here, but we could not find any of you. So we were trying to get online too, but so.
They were trying to keep us away, but they did not succeed.
Did not succeed.
We got here despite everyone's best
Well,
efforts.
that is wonderful to join us, Diego and Commissioner Shattuck McNally. Sorry for that run around. So we are on agenda item number 4 and the year 2 funding plan, and Carol just went over it brilliantly. Online, I cannot see your hands. That's just part of Zoom when we're showing stuff. So want to make sure you all have an opportunity to provide comments or questions or feedback on the plan. Yes, Beth.
Just for clarification, I think this is right, but year 1 is calendar year 2023 and year 2 is calendar year 2024. Is that correct?
Yes.
Good question. It gets confusing. Yes, ma'am.
Could I add it to make it even more confusing? It doesn't necessarily mean that you have to spend the funds within those years. They have, there's no limit at this point of how long you can take to spend your 2024 funds. But obviously it would make sense to spend them fast and then get to your 2025 instead of overlapping years.
Steve Olson, do you have any questions, comments, concerns?
Yeah, my mic's on. No, I was reviewing these And I don't think so. I think adding the additional items gives us that much more flexibility in how we use our funds. And so I'm supportive of that.
Thank you. Brian?
The only thing I was going to say is and I think we had talked about this a little bit last time, as far as stipends for folks with lived experience. I think we're kind of all here in kind of a volunteer capacity. So I don't necessarily know that I necessarily agree with stipends as far as that goes. But yeah, obviously, if the rest of the council wants to go that route, I'm fine with it.
Thank you, Brian.
Just-
Yes, ma'am.
I just wanted to comment, by putting that in here, it doesn't mean that we have to do it or the council has to do it. It just allows that flexibility. And I think that discussion about stipends will probably be something that the chair would want to do at another date.
But thank you for the clarification, Carol, and thank you for bringing that up, Brian. So what I'm hearing for clarity, it's just allowing the flexibility. If we desire to do that, then we can.
Right.
Okay, thank you. Commissioner or trustee in the room?
I like what's been added. I agree with Mr. Olson that it does give us a lot more flexibility, which I think is always good, because we never know what's going to come up. And thank you for adding that conferences. I think that's really important. As I mentioned earlier, I went to the one and it was a great, well spent time there. So I like what I see.
Thank you.
So I wanted to piggyback on that. I think it's great that we have the conferences and other time built into that. Also, when we talk about sponsorships, I think they had with our Rethinking Addiction, I asked Jay about that. I think it was with 350 folks, which is more than before. So I know it was increased, but I don't know how many. But I think that also is an opportunity for that maybe we need to talk about other activities or things like maybe some of this the Attorney General work, or having, I don't know if there's other things we could sponsor or do. And I didn't know if we had that conversation about more education as us bringing folks together versus having some of these outside groups, if we wanted to sponsor things. Or have an event, because we talked about doing some awareness events or kind of introducing ourselves or what we're doing. So I didn't know if that's what you had thought about, Carol, with some of the costs for something like that, or is that kind of all built in or not, or?
Yeah, this group decided to sponsor the conference this year. And when I looked through here, I thought, well, that isn't really spelled out. I think we better put that in as well. So that's what I intended by conference attendance and sponsorships. So if we wanted to sponsor other conferences, we would be covered.
Again, creating that flexibility. That we don't have to
Right, it's not a
revisit.
requirement.
Okay, great.
Cool. I just wanted to know, Carol, and just in case you had reimbursed the different buckets, but I did get reimbursed by the state COAG for being a speaker that covered all my costs.
Nice.
So our council won't have to cover my
Oh,
costs.
good.
The state covered my costs. So I just wanted to let you know I received that this week. So if you want to talk to Brenda, so just wanted to make sure since I was a speaker, so.
Appreciate that. Well, go ahead.
So for the carried over uses, are we asking for new applications and are those carried over uses open to other applicants for that same purpose versus the year one grantees?
Yeah, the conversation at the last meeting was,
And I think I might have missed the last meeting.
Yeah.
So I apologize.
no apologies. The carryover were for those specific. They were going to come back with whatever their request is for year two to them, for the year two plan. Is that correct? But my understanding?
That was my understanding, that the group wanted to continue that work and not cut that off after the first year. I do recall some conversation about whether the group wanted to award the same amount in the next year or maybe some lesser amount. But you have the ability to amend the plan. So if you decide later you want those amounts to be smaller, you can do that.
Yeah, we have all the way up till March 15th. So the request to the awardees, the four of them, was to come back with what are they looking at for cost for year two? I appreciate the work. I do want to make one disclosure, and this is a fairly new disclosure for me. When we're talking about the North Colorado Health Alliance, I now serve on their board as of yesterday. So I just want to be disclosed when any vote around the alliance, I'm going to abstain, just so there isn't any perceived conflict of interest with that. So that's brand new. Just got on their board, and I announced it to their board yesterday that I don't want any. I'll make sure we disclose that out in public.
Would that be something that even the vice chair should run the vote?
I don't know. I don't believe, as long as I don't vote, I
Okay.
abstain, I think we'd be fine, but we could certainly ask David that question. I will. To make sure.
And I'm just curious, because I know that happened with someone else and they actually recused themselves out of the room. So they weren't even in the room for the discussion, not even had any kind of, I'm just curious. I don't know what the procedure is because I've seen it done different ways, so. Well, congratulations.
Thank you. All right, a motion for,
I'll make that motion to approve our draft 2-year plan as presented today.
Second.
we have a motion and a second. Any further conversation? Hearing none, all those in favor?
Aye.
Anybody oppose? I will abstain because there is the alliance piece on here for year two. I just want to make sure it's not because of the plan, it's just because of that piece with the North Colorado Health Alliance. With that, the plan passes unanimously with one person abstaining. Okay. Will we go into agenda item 5? At the Rethinking Addiction Conference, we were asked, Region 2 and Region 4 out of Weld County, to provide some update on opioid data. And Dr. Jared Olson he's our population epidemiology for the health department, presented that data. If you all recall, it was about 6-7 months ago, Jared gave us some data, and we thought it would be a good time right now for him to update us on data while we're starting to look at our two new priorities, being housing and social connections and third safe spaces. So I'm going to ask Jared to give us an update, and then we'll open it up for questions. So Jared.
Thank you so much, Tom. I will, apologies if you were also at the Rethinking Addiction Conference. There will be some of this that's similar, though based on some of the questions we received there, I did add a couple of pieces about a particular trend within our Hispanic population that's worth noting and paying attention to. So just the overall, that was great. Thank you so much, Caitlin. Just the overall scope, just kind of where we are. You can see our opioid deaths here. We have, OxyContin hitting $1.1 billion in sales in 2000 and the ramifications, consequences of that. We did see, as we've shown you previously, a prescribing decline, particularly among younger age groups, those under 18 and young adults. That was pretty significant during that kind of second half of the 2010s. And then the deaths we really associate with the burden of fentanyl on the next slide. So you can see here, we've got all of our accidental overdose deaths in the county, steady or declining from 2016 to 2022. However, our accidental overdose that have fentanyl present continue to rise. And that's really what I want to break out for you today a little bit. So if we look, we obviously know we have a smaller population of Hispanic individuals in the county, Hispanic residents in the county. But that among that population, we are seeing a rise. Apologies. Perfect. We are seeing a rise in the rate of overdose deaths among that population. So as we've seen, like 2020 is kind of a turning point year for us in deaths. We see an increase, but increase and then a decrease for our not Hispanic population. But for our Hispanic population, we see an increase. We know that's relatively small numbers. It's only a couple of years. However, we also know that Weld County and other counties are experiencing something similar. So that's another reason for some attention being paid to this. Switch to the next one. Perfect. Okay. So if we want to look at all of kind of the Front Range Metro down through the Denver area, but not including El Paso County, the red color here is the 2020 number of overdose deaths among Hispanic, all races. So that would be white, Caucasian, white, Black, African American, Asian, Hispanic. So just by ethnicity. We've seen an increase from small numbers, right? Only 4 in 2020 in our county to 11 in 2022. Jefferson has had a similar increase. Arapahoe, Adams has had a very large increase. Weld has seen a significant increase. And Boulder has been one of the few places that's actually gone backwards, as has Denver County. So just the raw number has increased there. So I believe it was Councilor Olson who asked this question at the conference. We are seeing a regional trend. It's not clear that it started in one particular location and moved to Larimer County necessarily, though Denver does stick out a little bit here. And if we flip to the next one, you can see that the rates of death among Hispanic individuals or the Hispanic community are a little higher in that Denver metro area. So up to 40 in Jefferson County, and then around 30 for Denver, Adams, and Arapahoe County in this most recent 2022 year. Weld and Larimer County relatively comparable with their rate, but a little bit lower. Boulder and Broomfield a bit of an outlier, right? So we're not. Alamosa is obviously a very small numbers, very small community that's encountering significant challenges. Pueblo has ongoing challenges as well, but that Denver metro and then Northern Front Range are still significant challenges. So one of the other pieces we looked at here was among our youth. If we switch to the next slide. So just, we don't have, fortunately, we don't see among our hospitalizations, we don't see a high number of youth who are entering the hospital for accidental overdoses associated with opioids. Most of the accidental overdoses are associated with an accidental ingestion. So a child finding a pill on the ground, something like that. The poisonings or overdoses in general for under 18 are predominantly for intentional suicide attempts or suicide related behavior. And we do see about 1% of our opioid related visits to the emergency department are among children under 18. But again, it's relatively small numbers. And as I was saying here, we do have some information from the Healthy Kids Colorado survey. So if we look at high school students who took prescription pain medication in Larimer County without a prescription in the last 30 days, so this is kind of our best analogy to something that might indicate opioid use, at least on a relatively regular basis, we do see a persistent disparity between our white students and our white non-Hispanic students and our Hispanic students. So 2017, a little over 4% compared to 6%, a bigger gap in 2019, everything under 8% of those students reporting, but just consistently seeing that over 3 cycles of survey, in addition to a growing burden with our adult population is something worth noting and worth paying attention to. We have seen this shift before nationally, predominantly or in the 2000s and maybe even early 2010s. Most of the highest rates of opioid overdose death were among white, non-Hispanic population. We saw a shift to African-American populations, particularly Black African-American populations in the later half of the 2010s, and an increasing burden of overdose deaths and opioid use among that population. So it would not be terribly surprising to see the burden shifting between different racial and ethnic populations.
Ryan, do you have a question?
Nope, all good here.
Steve, I see your hand up.
Yes, sir. And maybe I'll just wait till the end and then I'll ask my question, refer back to the slide. So I'll let the presentation.
I'm done.
Here it's done, so.
Okay.
You're ready.
Well, then just curiosity, going back to the rates.
Yeah.
And I see it's My slide's not numbered, so I can't tell you. Anyway, where you have the Hispanic and then the others, what the rates are, what is it, per thousand or what?
Per 100,000, yes, that's per 100,000.
100,000, okay.
So obviously that rate is much higher than the actual number of people who died for our Hispanic population because our Hispanic population within the county is less than 100,000 individuals.
Okay. All right. Thank you for that.
Yep. So, and if you're looking for like a raw number, last year, accounting is a little bit different between our local office and the state office, but for purposes of comparison across counties, we saw 11 individuals who died from any opioid overdose who were of Hispanic or ethnicity in Larimer County in 2022.
Yeah, for future, I'd find it interesting because the populations of the county vary considerably, is to maybe have a notation as the population for the county and then the raw number for the deaths.
Great. Thank you.
Thank you for that. Commissioner?
Mr. Chair, Dr. Olson, thank you for all the work and all the data. I think it's so nice to have, great information to kind of help us track our progress or what's happening. And I want to first thank you for your work. I heard a lot of great things from your presentation at Rethinking Addiction. And I was just curious, when you talk about taking prescription pain medication, you're saying that comes mostly from self-reporting from Safe to Tell and from the ER?
No, so that graph on there from children is a result of self-reported behavior on the Healthy Kids Colorado survey that the school districts administer, TSD, PSD, and Estes Park.
So maybe I missed this and I apologize. I've been all over, I literally been to the Light Ed, to DU campus and all over the state in the last 36 hours. So I apologize, I'm a little excited. When we talk about
Hospitalization data?
Yeah, and then also with the overdose deaths to any opioid.
Yeah.
What did you tell us the number of fentanyl overdoses at all for there? What's the total for 2020 or 2022 for?
2022 for any overdose death with fentanyl, I believe was 42. Let me look.
Yeah. Think about it.
Yeah.
Where is that?
That's the very first graph.
The overdose, this one. Oh, this one.
With the-
Okay. Oh, the first one. Okay. And then how many of those are under the age of? I consider kind of.
In 2022?
Yeah, under 25.
Under 25, 2022 was a particularly an unusually bad year for overdose under 18. We had 3 overdose under 18. Under 25, I'd have to double check. I think there may have been at least one additional one in those direct ages, but I'd have to follow up with the coroner.
And then maybe you don't know this, and I apologize, maybe you could follow up. When we compare, you have these other ones we're comparing to, but of our similar size, all these are bigger than us.
Yeah.
But I know we have the 4th largest city, so that's always kind of skews kind of how we look at apples to apples there. But
We're bigger than Boulder.
are we bigger than them?
Well, are we talking about overall population or just Hispanic population?
Yeah, but overall.
Yes, overall, we are larger than Weldon, Boulder.
Okay.
Total population for our county.
Okay, so
We're a bit older as well.
I know Boulder's shrinking, so I just, youth-wise, how do we compare to other counties? Youth-wise?
I will have to follow up with that.
Okay, thanks. I'm just
And
trying.
by youth, do you mean under 25? Is that?
Yeah, because I consider kind of youth in college too,
Yep,
because that's where, and then this rainbow fentanyl stuff I've been hearing about.
Yeah.
Has that been increasing? Do we know, or is that really, maybe the district
Yeah.
attorney knows, what
Yeah.
kind of information? Because I hear all these different stories.
It's no more potent or lethal than anything else. It's mainly just a marketing technique. I mean, different suppliers are providing different colors to try to distinguish and market. And so it's definitely present, but I don't think anyone thinks it's more dangerous or more addictive or anything like that.
There was this period there's this period of time Boulder earlier this, like kind of end of the summer, had pink, like a pink powder that they had found implicated in a couple of overdoses. I'm not necessarily deaths. I think some of them were reversed, but that showed up, but very much as District Attorney is referring to.
And sometimes a certain batch can be more lethal because of the way it was mixed. So if they find, hey, a couple in this last couple of weeks were related to a pink batch, that's going to cause concern about a pink batch. But the pink batch 3 weeks from now could be less lethal than others. It's not really any relation to the color. It just might be a distinguishing mark where they're going to put people on notice temporarily.
Okay, all right, that's helpful. I just hear things, especially from college students and just trying to get back to what is really happening. So, yeah.
Yeah, and there was a good bit of concern about blues or pressed pills that were, looking like Xanax and some things and potential use by children. That is not something we have a ton of information about. It's not something that's asked about directly on Healthy Kids Colorado. As I mentioned, we see the majority of intentional ingestions that result in an ER visit for some sort of substance or marijuana for youth, right? More so than opioids. So we just don't have a ton of information about that. I'm hopeful that the concerns around the potential potency and risk of fentanyl means that there's more awareness among youth for, pressed pills and things of that nature.
So my next question, real quick, and sorry to take on this tangent, my head's kind of spinning with a lot of trying to switch from forest health and fire mitigation to opiate here. Seeing this trend in different populations and outreach, is that something that Defense Council or the Health Department are being kind of pivoting really quick to try to do an outreach to that in different languages or different kind of a peer-to-peer kind of getting kind of word out? I'm just thinking about some groups that I could call. I don't even know if they're aware of this. And just curious about, is that those conversations happening and what does that look like?
I think from my perspective, so let's say looking at the deaths that we reviewed among the child fatality reviews, one of the key commonalities is a lot of adverse childhood experiences and often very early exposure to substances and substance use. So those two tend to overlap. We often see suicidality, adverse childhood experiences, and opioids overlap. That's a pretty well documented phenomenon. For some of these individuals who are succumbing to an overdose relatively early in life, they have a pretty long history of use and quite a few documented traumas, let alone the ones that we can't see. So from my perspective, protecting kids in general and supporting kids, promoting resiliency, especially our most vulnerable kids for whatever reason that might be, is some of the best protection potentially against opioids and its potential negative consequences.
So I'll kind of refine my question a little bit, but I appreciate that. I know we talk about that a lot on LICOG. Hispanic, I'm talking about the Latin community as well. I mean, I don't know if we've done a lot of outreach in with language justice and making sure families are aware of that, or through organizations. Is that something that's happening or something we should look at maybe helping sponsor some?
Yeah, that's a great question. And
I don't know
partly,
if we have any of this translated
Right.
into, I'm just curious.
Prescription, safe storage of prescription drugs, things like that.
That I know of. Do we
No.
need to kind of do that? I'm just curious.
yes, we do need to look. That's partly when Jared was showing this trending data that's not good, especially for our Hispanic communities. That's partly to bring it here for that conversation where language access is a centerpiece of the work. So I do believe that should be something we discuss and move forward with language access and doing all our materials and making sure outreach is equitable. So that
Could we look at maybe, I don't know whether it's the direction of this council or someone else to reach out to, like BIPOC Alliance, Heart and Soul, some of these other groups that have networks, and get that information into their hands to just try to save as many lives as possible, get that out into some of those groups that have those networks and
yes, didn't mean to interrupt you. We definitely could do that through our community outreach team at the health department. I think that's a great idea. We can take those efforts along.
when we talk about peer-to-peer, they're kind of trusted sources. I thought maybe if we just quickly got that information translated and got it out.
Absolutely.
I just think that maybe the sooner the better, just an idea. So just curious about that.
Thank you for that.
If these other counties, obviously, most of them have experienced a similar spike in Hispanic overdose rate. Have they also sort of seen the same flattening, non-Hispanic?
It's pretty variable. So I did look at that. Some of them are rising, just not as rapidly. Some of them are flat. So there's a little variation on there. And I honestly don't know what the underlying, patterns and trends are that are driving that as far as, severity of the burden or risk of disease or risk of death associated with the supply or the use of the supply versus, patterns of new use or individuals in the population. So it's, a little
Gotcha.
clear.
The other question I had is I'm looking at this map page and I'm, trying to figure out sort of what is statistically significant between these counties. Obviously, comparing that to that page I was just on, right? If even our 2022 increased rate is still, or not rate, but overall number is 11.
Yep.
Is there a lot to sort of make statistically of these variances between counties?
So when you get into some of your larger metro counties, some of those differences are statistically significant. So like the difference between a Jefferson and an Arapahoe population wide. Weld has seen a statistically significant increase in their rates of death, right? Over time, right? So year over year, but ours is not because of our small numbers for that exact reason. So that's why if we were on an island and we were standing alone, I would probably be like, that's not a great trend, but it's also not entirely clear that that's not some sort of noise from small numbers. But I think married with the rest of the regional data, right, and we're part of that region,
Looking
there
in
is some
the
sort
bigger
of
statewide context, it looks like it's an issue.
exactly, yeah. And the same goes for Alamosa County, right? That's there a few deaths in a very small population county like that will make that range.
For answer all my questions.
Yes.
Sometimes I just think out loud and I just talk to people. I was like, I'm thinking, I haven't seen any of this in Spanish. Do we need to do something different? So
That's very funny. And if you recall, over a year ago, when we all formed, was all about wanting to make data-driven decisions and looking at the data continuously, periodically, and seeing where are there gaps or where are there trends. And here's a trend, what we're seeing. And I think it's important then to have the conversation around what are we doing for language access or culture access, those things. And it's important making sure that there is peer-to-peer trusted. So that's why partly of this, I appreciate that. Any further? Yes, Beth.
Just made me think that it makes me appreciate the fact that the state's the focused outreach toward youth is in both English and Spanish. And certainly we could use all of that. I know Commissioner Shattuck McNally has been pushing that and bringing it to our meetings, and maybe those materials are available. And if there's a way we can get those out into the schools, and maybe even specifically to areas that we know high levels of Hispanic residents live, could be helpful.
Absolutely. We meet with, Jared and I and others meet with 3 superintendents and others, school districts, with Nathan Riggs regarding the Blues program, just to get updates. And I think it's important Jared shares this information with them and we move in that path. I agree.
Trip, I just want to know with Sergeant Cook here and having his co-responder program in the schools and probably very aware of the information in the schools, that I would wonder if we could ask him a question, what he knows about outreach in the schools and
Sure.
in language justice for trying to reach out to understand for families about since we're seeing this trend in increase in Hispanic deaths. Do you have any outreach in Spanish to families and to students, or what kind of outreach is happening in the schools that way?
So we have a presence, as you know, Commissioner, in Thompson School District with our Youth Crisis Response Team, which is the co-responder unit that operates in schools. We do have access. One of our deputies who's on our team speaks fluent Spanish. And he has been utilized a couple times to help translate, specifically about the opioid overdose issue. I know that thanks to you, we were able to get those posters put up in each of the schools. Beyond that, though, I'm not aware of any specific outreach, directed outreach we're doing specifically for that. But we are, of course, with our co-responder team in the schools, are dealing with opioid use, drug use, substance abuse issues, along with the mental health issues. And a lot of times, obviously, as you know, they are co-occurring. So we deal with that kind of thing on a daily basis.
Do you think then, if I might ask another question, do you think having some information translated to go out to families targeted in the schools to kind of help might help?
I think so, yeah.
Okay.
Because we do often run into situations where the kids obviously are speaking English, they're dual language, but the parents are not. So sometimes that barrier can be significant. So having those materials available to them to kind of educate them about what the kids are getting at school, but maybe not what the parents are actually getting because of their limitations with English would be great.
Thank you for that. I guess I'm just looking how we can get it more upstream or what we can do. And I thought since they're really working with families, maybe they, would like to know what's happening. Thanks for getting all those posters up in all the schools. And if you have leftovers, maybe we'll take them over to Cooter too. So, yeah. Or did you get those up?
We do have Cooter as well. Yeah.
Hey, wow. That's pretty awesome. Thank you.
And I took them to Estes Park, so we've got great.
Let Attorney General know we got those to all three.
Wonderful. Jared, thank you for that. What I'd like is to get Jared here periodically, maybe twice a year, give us updates on data. So we're making those data-driven decisions.
And I just want to make sure we're okay. I know I'm going to be working with the paper to do an article in Estes Park paper. Is it okay that, do I need any permission to use the information you've provided?
Can I just look real quick?
Sure.
Double check. Yes. Oh, no, because I didn't. Yep. This is all either from our coroner's office shared with us and it's publicly available, or it's okay to be publicly accessible, or it's from the state dashboard.
Okay.
Because I don't have access.
Thank you for that question.
Okay, thank you.
Okay, before we go to our important item number 6, our fiscal representative Carol did ask me, just to be clear here, when we're talking about our money, would it be possible to have the council approve through a motion reimbursement for the town of Estes for trustee Lungland's conference attendance in Montrose? And did anybody else attend besides the commissioner? Beth, did you attend?
Yeah, she did.
Yeah, so you did attend. So we will add Beth Yance as well.
I don't need reimbursement though.
You don't?
No,
Okay.
the city paid for my attendance there.
But we can
reimburse the city.
It's not necessary.
Okay,
It's part of my
So,
conference and training budget.
okay. So we're looking for a motion to reimburse a trustee, the town of Estes Park for trustee Young.
I'll make that motion.
We have a motion.
I'll second.
We have a motion and a second. All those in favor?
Aye.
Aye. Any opposed?
I'll listen.
And we'll have one abstain. That makes sense. Thank you for that. Okay. I'm excited to have Tanya Wheeler here. She's the executive director of the Advocates for Recovery Colorado. She's been the executive director since 2009. We called her up from the last meeting regarding our 2 new priorities with housing, those for recovery treatment, and then social connections. And she's going to talk to us a little bit about kind of the pitfalls and what to look for and some other resources that are in the state. So when we're making some informed decisions, we've got that information. So Tanya, I'll turn it over to you.
Thank you, Tom. Hi, everybody. My name is Tanya Wheeler. I am a woman living in active and sustained recovery. And for me, that means I've not used drugs or drank alcohol in over 33 years. I entered into recovery at the age of 22 with 2 small children and a lifestyle that was killing me. And so I'm originally from Texas, and after I had been in recovery for a couple of years, I started working on my licensure to be a drug and alcohol counselor in Texas. I obtained that and then moved to Colorado in 1999. So I worked as a counselor until 2009 when I became the first, and I've been the only executive director of Advocates for Recovery Colorado. We are a peer-run, peer-led, nonprofit, authentic recovery community organization. And what that means is that we don't provide any clinical services. I have since let my counseling credentials go, and my real focus is, and I think always I wanted it to be, on helping people in the community, because I was very young when I started using drugs and alcohol, and I'm very grateful that I found recovery at such a young age. So in our organization, we employ what we call peer recovery coaches. Again, none of us do any clinical work, and it is truly a person with lived experience who has lived through their addiction and now lives in active and sustained recovery in their own communities. And so everybody on our staff is either in recovery, and we have one person who is a family member who lost her child that in 2018 at the age of 25 from a heroin overdose. And so we also help and support family members that are struggling with their family members' addiction. I had a great conversation with Tom, and I really appreciate MJ making the connection, because us and NCHA do some work together. We have done some grant. We have gotten a grant from Region 4 out of the opioid settlement dollars, and that money is there for us to be able to have our organization as well as MJ and their organization to be able to help the people out in the community. So one of the things that I've always said is that it's pretty easy to not use drugs and alcohol when you're in treatment, especially residential treatment. I know, because I did that 4 times, right? The real issue is when we are back in our home community and we don't have that 24-hour-a-day support around us all the time. We believe at Advocates for Recovery that the opposite of addiction is connection. And so that's really our focus. We need to help people to be connected to positive supports and other people who are living in recovery within their home communities. So we provide peer coaching. And basically that the coach is someone who's just a supportive person who themselves is in recovery, who helps we call them participants, not clients, because it's not a treatment center. They use the participants, help them to be able to look at what their needs are to help them maintain their recovery. And so as you guys have been talking about, 2 of those things are supportive housing and a nice, safe place to lay your head at night, and also the connection of that social connectedness. So my organization collaborates with a lot of folks, and some of you may be familiar with the Colorado Agency of Recovery Residences, or CAR. And I actually sit on the board of directors for CAR. So they're the folks who oversee the recovery houses, the recovery residences. And they have some very specific rules that they require these houses to follow. So it really has some structure, and it has a grievance opportunity for the residents who are living there, as well as the opportunity for, the people who live in that house to support each other and work together and connect about what social activities they do to maintain their own recovery. So that's one of the reasons that Tom asked me to come and talk. And the other one is that we do a lot of social connectedness. So within our organization, we do barbecues, go bowling, spend time together. We don't host 12-step meetings, things you might be familiar with like AA or NA, because sometimes those meetings themselves can be an obstacle to people because they're not necessarily doing recovery the way everybody else is. And one of the things that we found critically important is that we need to support all pathways of recovery. And at our agency, we believe that people are in recovery when they say they are. So as I shared with you, I practice abstinence. And believe me, in my early 20s, I tried to just let go of this drug or this substance. And for me to be successful, I needed to practice abstinence. I think that the process of recovery for each individual is very personal. And oftentimes people will, and this is my own experience I'm sharing with you. So my really primary drug of choice was methamphetamine in my late teens and early 20s. I could not see in the beginning that I had a problem with alcohol or with marijuana. And so in the beginning, I said, okay, I'll quit using methamphetamine, but I'm not going to stop drinking and I'm not going to stop smoking marijuana. It took like another year of my own experience to see my own problems with those substances before I came to that conclusion of the only way for me to be successful in recovery is for me to practice abstinence. What peers can be really good at is helping people hold their hand, not push them away because they are practicing what they believe to be their own truth. So one of the things I say often is we don't push anybody away. So if somebody is coming in and they stopped using cocaine, but they're still drinking alcohol, we don't say to them, you can't be here, or we're not going to work with you. What we say to them is, let me stand beside you as you walk through this and explore what the right avenue for you is. And so obviously when we have our events, our barbecues, our fun times together, there are no substances and there are no substances allowed. We have a drug-free workplace, so I don't hire people that are using substances, but I don't want to lose the fact that sometimes folks need to be given the opportunity to be able to have their own experience with that, to bring them to the realization that this is what I have to do for me. So instead of the 12-step meetings, our support groups are called all recovery meetings. And what that means is everybody's welcome. People are, we're not going to do disruptive stuff, but our support groups are different from a 12-step group because we encourage what they call crosstalk. So our participants talk to each other. They share with each other what has worked, what has not worked. And again, everybody is clear and supports the idea that everybody is welcome. So it's a very open, loving, accepting place where people who are even thinking maybe they have a problem can show up and talk about it, and not there's no judgment, no shaking your finger, because we've all been there. And so just that level of support. So we've got the coaching, we've got the support meetings, and then we've got we call them recovery social activities. And I started, obviously, and I actually started in 2001 when the organization was just an idea, and I have never left the table. I went from the vice chair of the board to the chair of the board to the executive director, and I've been involved in all of that. For many, many years, there was no funding to support recovery. There was funding to support treatment, but what would happen is that people would go to the treatment center and they would come out of treatment and go home to their home community. And the only option coming out of treatment was to say to people, go to AA or go to NA. And we run across folks all the time that say, I'm not going to those meetings. And so my question when I'm working with people and when my staff is working with people is for us to say to them, I don't want to talk about what you're not going to do. Let's talk about what you are going to do. And we know how important connection is. So the question is, where are you going to connect to support your recovery? And we start from there. We now have, well, in 2017, I opened an office. We got some state funding for the first time to actually support recovery and not treatment. I had one staff person, and he and I started in 2017, just in the, it's really unincorporated Adams County, where our office is. And we have grown since then. And of course, blessed with the funding because this works. We have data to back all this up. We now have 6 offices across the state and 18 staff members. I am still hiring. And one of the places that because we did this joint grant with MJ and NCHA in Region 4, we've been able to work together to have treatment services, recovery support services using peers, as well as care managers out of NCHA. And so what's happening is people are either getting outpatient services in their own communities, oftentimes living in recovery residences, but they are actually getting some support around finding who to connect to. Where do we build new friendships? Where do we find people that are not using? But we're not just sitting in a meeting one time a day. We're actually living life and staying connected to each other. So I guess with that, because I really want you guys to be able to ask some questions, I want to know what I can answer for you in regard to recovery residences. I am experienced, like I said, with CAR, and also I've worked a lot with Oxford House. And so I know a lot of the ins and outs of that, and then also the social connectedness and the importance of that. So how can I help you? What answers can I, or what questions can I answer for you?
Thank you, Tanya. Questions? Let's open it up.
So thank you for being here. And thank you, Tanya, for sharing your story. And I see Christina too. Thank you for sharing your story, and thank you for your work. I know you're commissioners in Adams County, and I know I've heard your services mentioned once before. So I was just texting Chair Odoricio, like, hey, I'm hearing you talking about Adams County. So I wanted to ask, so these recovery houses, are you funding to run the house? Or are you paying for vouchers for people to pay to be in the house? That's my first question. The second question is, if there's not enough room or enough housing, are you also having funding going for safe spaces for people to gather and connect in other ways? So 2 questions there. Sorry to kind of complicate it.
No, you're fine. So there is not, there are some scholarships. Let's start there. And those are state funded to help people pay that initial. It's not really a deposit. It's more of like, there's a move-in fee, right? And it takes care of all the administrative stuff. And most of the houses do that. And then usually the first month's rent. And the state of Colorado does have scholarship dollars for that. You guys are likely familiar with Signal Behavioral Health Network, and Signal is the one who is helping make sure there are scholarship dollars to help people to be able to get moved in to these houses. I don't know without looking it up how many recovery homes there are in Larimer County, but I certainly could gather some of that information and bring that back to Tom to share with all of you. And I would need to ask too, how many Oxford houses are there? Because either of those, I think, can qualify for those scholarship dollars. The idea is to build more recovery housing so that we have enough room for the people that's their home community to live there. Certainly, we don't personally get people in to the housing. That can be done with us or without us. A peer recovery coach could absolutely walk alongside somebody and help them get connected and all the information and who to talk to. And that's what we do. But the actual housing itself, my organization doesn't do that. But we know a lot because we help people all over the state. So I think it would be very positive for you all to have some connection to maybe the director of CAR, and maybe the person who is in charge of the Oxford House information, and I could certainly connect that for you, Tom. The other piece is, yes, we do the recovery support, the coaching, the social connectedness, all of that stuff. And we don't charge anybody to do anything. Everything we do is grant funded. And yes, we're getting money out of the opioid settlement dollars. So that is a thought to really target Larimer County. If we did that, we could actually look at opening an office in Larimer County and having one or two peers, whatever we need, to help serve the people, have people on the ground that are planning fun things and social activities and could be there to connect with the folks coming out of treatment, or oftentimes people that don't even get to go to treatment because there's not enough access to treatment sometimes. I would love to see us do that. We are working, I shared with Tom, we are working with MJ on putting a peer recovery coach inside of the emergency department at Poudre Valley Hospital, because doctors and nurses are busy and their job is to medically stabilize people, but we have been doing this in some other areas of the state. And what happens is that peer can really connect to that patient and then hold their hand and say, what can I help you with? Do you want to go to treatment? Do you want to connect in with us? Do you want to be part of our community? And the more we do that, we honestly save dollars in the medical system, right? Because we're keeping people from revisiting that emergency department over and over and over. So we do have a presence there, but we're just starting to come in. And obviously we need to be able to have, it doesn't have to be huge. We have often started with an office in other space, a place for a coach or two to be, to connect with the community, and then for us to be able to host some of these support meetings and the social activities to give people in Larimer County something to do that are in recovery with positive support.
Thank you for that. Christina, I saw your hand up. Do you have a question?
Thanks. It's so great to meet you. You give me a lot of hope. I'm a similar mom who lost a son. And that was always my mantra. If they have one person who believes in them and who can coach them, who probably isn't their parent, their goals can be met. And of course, as you know, recovery is possible. So one of my questions was about housing. The people that my husband and I know, a lot of them are women who have told me stories of not wanting to go to recovery because there's no one to help them on the way out. and there's no housing, especially if they have young children. So what have you done in your county for the young women or the women who might be middle-aged?
Thank you, Christina, and I'm so sorry for your loss. That is, it's got to be devastating. I have children and I can't even imagine. So yes, young women with children is certainly a high-risk population for coming into recovery. And quite honestly, and this is from my own personal experience, it's hard. You know, I was parenting two children that were 5 and 1 when I came into recovery by myself, fathers that were absent from their lives. And I think that one of the greatest things we can do for people is to give them the connection to other women who have been there, who have done that, who have succeeded. To be able to, it's amazing when you have a peer that can work with your folks who has the same lived experience. And that goes a long way. I think that's how the hope is best translated. I know that Oxford House has some homes that are for women and children. I also know, just to make it equal, they also have some houses that are for men and children, so single dads. And the way somebody opens a recovery residence is an individual becomes the owner of this house. And then they have to meet certain standards in order to get it certified, which is what CAR does. And in order to, they've now changed the laws in Colorado. So any treatment center now has to refer to a house that is either an Oxford house or is certified by CAR. Some of the, I think, Tom and I talked about this some. I recall before 2009, when CAR was created and there was no certification for recovery houses, people would just show up and they'd open their house, which a lot of folks, their heart was in the right place, right? They just wanted to help people have a place to stay safe and get better. But some of those places were opening their doors, and they say there are 10 people that they let live in their house and they're charging them $500 a month. That's a lot of money, right? And I think money was the motive most of the time back then. And I actually heard a horror story of a house that was where they had people sleeping in the attic so that they would have enough room to let people come in, and they were collecting all this money. That's what CAR and this certification model has stopped, because in order for people to get, well, they can't get a scholarship and go into a house unless they're certified by CAR. And Oxford House just gets to be its own entity because of how many years they have been around. And I don't even know how many that is, but I know that in the state of Colorado, they have over 100 houses. And so they really have this way to be able to hold some accountability, but at the same time, allow people to move out on their own. And there are rules in a lot of these places. Many times, the more private owned but certified houses under CAR will either have treatment within their home, or they will have people who are in outpatient treatment who are living in their homes. That's not as common in Oxford houses, but with the CAR certified houses, that is absolutely true. I think that all the support we can wrap around people, and the reminder that recovery really does happen and people really do get better. And for those of us who are living as that example of that, I think that's what instills the hope to the person who has the addiction, all the way to the family members who, by the way, are struggling themselves by having to watch their loved one go through this and feel so helpless and powerless over that. I have a huge spot for the kids because, like I said, my kids were 5 and 1, and they're grown now and have their own kids. But we need to make recovery a family event, a family affair. I have one of the guys that works for me says to people, his parents were really sick from exposure to him, which I think is a perfect description because people don't sign up for this, right? It happens. And it's one of those things that has all the stigma and shame around it. And oftentimes people don't disclose, they don't talk about it. And we give them a safe place where it's okay to just be whatever is going on in your life. I hope that was helpful, Christina.
Any other questions? All right. Thank you very much, Tanya. Appreciate you
Thank
coming.
you so
I
much.
learned a lot. I got a bunch of notes here.
Well,
Okay.
I would love to follow up. You feel free to call me. If I can, I'm actually in Texas with my father, who's going to be 81 next week. And he fell down in mid-September. So I am here kind of taking care of him, but I would love to come out and join the crew in person and talk more. Whatever I can do, you guys, please let me know.
We will. Thank you,
All
Tanya.
right. I'm going to log off and let you guys finish your meeting.
Thank you very much.
Thank you.
Thanks.
Nice to meet you.
You too.
All right. We got 15 more minutes till time. We want to put on the agenda this discussion around competitive versus targeted funding. As you recall, we had this conversation last year in some capacity regarding, we chose to go targeted funding. We selected the 4 foundational agencies working on the variety of different work, such as the co-responder. But now with housing and the social connections and the community connections and those things, thought we'd better open that conversation back up. But starting off reminding, the council doesn't have a staff. We do utilize some county staff. Thank you for your work and all the work you're doing. That we do fund through our administrative bucket. But if we do go competitive, we're going to need to make sure there's some road boundaries on this or roadblocks, because we don't have the ability to go RFAs, RFPs, and kind of those things. So that's just one of those unique challenges we have. Carol, what would you like to add from the fiscal representative on that regarding just keying up this conversation?
So David Aero, who is the attorney for the council, did say that we did not have to do a competitive process. So that does allow us to do this however we choose. I was wondering if there might be a process that looks a little bit less formal, like perhaps having a couple of groups come in and talk about their services around housing, and then the board could decide. Apparently we don't have to have formal written RFPs and all of that, as far as I know.
Well, thank you for asking, David. That's great. Okay, with that, let's open up the conversation.
Yeah, I know that last year, I think we discussed not doing that and doing the targeted because we had so little time and it came together so quickly. So I think everyone agreed that made a lot of sense. I'd wonder if this year, and maybe even people that went to the statewide convention would know, but what other councils are doing in that regard, because I especially think if we're just doing some of these pretty narrow categories that are not carryover, we wouldn't be inundated with RFPs, I wouldn't think.
Yes, and I got 2 voting members.
I just want to answer his question. So we went and we did hear from those because I sat through all along with Beth and Cindy. We heard from some of those other counties and regions, and some of them put out RFPs and never got any action. So they haven't, some of them hadn't even handed in their money from the year 1 yet. And some of them put money on feasibility studies to see where they should spend, but they didn't get a list of where they should ask to do. So a lot of groups certainly were, like Denver and all them, they had tons of opportunities to look at, and they probably had a little more process. It seems like we had got our money out and got it into groups that we know were working, and we got this data back that so far has looked really promising. And so if that's what you're asking, it seemed like a lot of folks had done some kind of complex systems, and then Mesa County just handed the whole RFP process over to United Way to run for them. And so, but I don't know what that looks like, but I feel like we have some, we have some expertise here, and I know how it can be very complex. Jessica Plummer runs our impact grant program for the behavioral health services, and that's like 80 people. There was 77 applications. It takes months. There's a whole big process. I don't think we need to go, certainly we don't have the staff or the capacity because she's paid full-time employee. I mean, I don't think we want to shift to be that extensive. And I think the direct allocations we had talked about the last time, that had worked, and we wanted to kind of not just do one and done and kind of drop them, but kind of let them kind of glide path into sustainability. And so I think it's great to know we don't have to, and having that balance. So if that helps answer your question, it seemed like a lot that did some of these formal LFPs didn't really have a lot of
Success.
I wouldn't say success. It just didn't have a lot of work to show for it yet. So I'll just say that.
Yeah.
I bet. I see your hand up, and then I see Steve, yours next.
Yeah, thank you. I was just wondering, I remember it was really helpful last year, and it's something similar where we bring together our subject matter experts and talk about the two, we could bring them together, talk about our two kind of target areas for next year and see what possible direct allocations could come out of the knowledge from that group in terms of the housing, like the woman we just heard from and her organization. Are there others that we could then do some direct like invitations, talk to us about would this be, a good use of our funds? Not asking them that, but for us to then determine based on what they do, whether they could provide some of what we're looking for. So but I do think utilizing our subject matter experts to help us identify some organizations maybe that we could look toward would be helpful.
Thank you, Beth, for that. So like we did last year, if I recall, it was in Loveland. Okay, thank you for that. Steve.
Yeah, along those same lines, the community we're looking at is relatively small. If we have an area we are interested in getting into, if we had a small paragraph, not to create a burdensome process, but to get that information out to groups such as NOCO Cares, which has, I don't know, members around 50 some organizations, to just say, hey, we're looking at this opportunity. Is there any organizations out there that might be interested in this? That way we could gain some interest from some of the other organizations. And it still leaves it up to our discretion, but it could give other organizations that might have a little twist to things an opportunity to expand their services.
Yeah, Steve, I like both Beth and Steve. So more just sending something out and saying, hey, do you work in this capacity? What can come present or come share your ideas, what you do? Is that what you're talking about, Steve?
Yes, exactly.
Okay, thank you. And did you have something? Sorry.
I'm just saying, we have a list of contacts that are kind of already in the space, already doing this stuff.
True.
And I'm happy to provide a lot of the insights that we've gathered over the last 4 or 5 years of those that have applied and those that have received funds already. And as the other organization was presenting, we are, the Behavioral Health Services Department is already funding a lot of the peer recovery coaches in the community. So I could provide a summary of kind of what we're already funding and what the organizations we're already working with in the community, and maybe putting all their heads together to say how they might want to work together instead of compete against each other in the same area.
Yeah.
I think that's very valuable information because we certainly don't want to, we want to enhance things and not duplicate things. And so getting more information on what's already being done, and maybe we can see the areas that need more strength there.
Mm-hmm.
I think
because this could bring more resources to the areas that we're already starting to see some progress in.
So that was exactly what I was going to talk about, because I think in previous sessions, we talked about there is an overlap here between behavioral health and what we're doing and this, but it's certainly not completely overlapped. So there are a lot of other folks that we have not heard from in this group.
Oh, yeah, a lot.
And because there were 77 applications last year for behavioral health, 7.5 million have asked. So there's certainly a need. And I know that we have some data and information about how they use their funds, how it went, and we could probably use some of that to kind of help, understand who's had some success and things. So I thank you for bringing that up, but I know that's like 5 years of data that we could really utilize. The other question I had is, and I'm sure she quite answered it, but maybe I didn't ask it clearly. I've heard, again, even if they were maybe living with family or not having the housing, a need for a space for people to meet, to connect. And I thought, well, is that something we also could fund, was the rent or clinician or peer-to-peers to go to a safe space to have like regular meetings? I don't know what that looks like. Maybe Marshall or some other folks, if there's somewhere we could help sponsor a time and a space and people to be there and have a regular meeting time for people to connect, somewhere where it's near transit and places, and maybe in different locations throughout the county that are not, there's a lot happening here in Fort Collins, but maybe we need to look at a space in Loveland or in Berthoud, and just for people to be able to connect and have some of that peer-to-peer time or something. So I didn't know if there's anything like that happening now, or is that something we could think about trying to build a network of spaces for people to have, we can't always afford a lot of housing, maybe at least a space for them to have regular meeting time to meet with others. So just curious about that, because I know some other regions were doing some things like that, and I don't know if that's happening now in our location, in our region.
I don't know off the top of my head if there is. I got 1,000 things going on right now, so I haven't really looked into it all that much lately. I can definitely check into it with a couple of friends of mine.
Okay, I would just be curious, because I think that also might be another way to low-hanging fruit to be able to provide more spaces. So
That's
safe spaces, third spaces, whatever.
part of the community health improvement plan. So good. That's great. That would be wonderful. So what I'm hearing with our short amount of time here is maybe I propose, sorry, Caitlin and I and Jessica meeting, and we sit down, put the game plan to invite from your list of data and no co-cares and others, so it's inclusive for the next meeting. And we can start doing just like we did last year at Loveland, getting on the whiteboard and getting ideas and starting that brainstorming session at the next meeting. What is next month? November? Is that a thought or an idea to move forward?
Yeah.
Brian, that's
I like that.
okay.
Do you think that a month, I believe the meeting is going to be very close to Thanksgiving. Do you think that is going to be a hindrance on getting people here? And is that enough time to get out, contact them and get on their schedule?
It's on the 15th, so it's really a quick turnaround, be like in 2.5 weeks,
Yeah.
right?
It'd be quick. We might have to do two meetings, do November and December. And December is what, when does December meeting on?
It's the 28th currently, which is something.
28th.
And
Yeah.
That's
Hey, boy, that's
yeah,
gonna
it's
be
probably
people.
not a good
We might
time.
want to look at that date too. So we got a couple things to work on. Yeah, I think I'm off. But we could certainly move that up to like the 14th.
We're back on track.
Maybe do two, and then when you're talking to people, they can choose which
Yep,
month would be best for their presentation.
okay.
Well,
I don't know.
we also have to leave time. We have 2 more grantee presentations for December, right? Or November?
We have one in November, one in December.
Right. Okay.
Yeah. I think
There's a lot of
We're up in
stuff.
November, right?
you're in November and then CSU is
December.
Oh, in December.
December, CSU's in November.
Yeah.
We'll do those right at first and then spend the rest of the time on this topic. Yes, ma'am.
I did miss last month's meeting. that was extended in time. Did you guys find that helpful to have a longer session? And is that something we need to look at maybe doing to get the work, this groundwork done?
It was beneficial because we needed the time. And we were able to get to the two priorities through the process. So, yeah,
I wouldn't be able to do that for the next meeting. I've got like 3 meetings overlapping right after that one. So if we could do it in December, that might be work, but yeah.
Beth, your hands up.
Yeah, thanks. I just also, before we closed out, I also want to just make a suggestion. I don't think it would have to be a very long discussion, but I would like to suggest that we put on our discussion for consideration, the whole discussion about a stipend for lived experience advisory panel members. I know it's been brought up a couple times, and I think we just need to go ahead and talk about it, make a decision so that we could start it in 2024 if we're in favor of it.
Let's remember to put that on the agenda. Yes, thank you.
Thank you, Beth.
Thank you, Beth, for that. Okay. We're almost that time. We got 30 seconds. Great ideas. I do appreciate this because I came walking in going, I don't know where we're going to go. But what we'll do, 3 of us will sit down, meet, and we'll start planning, trying to get our partners and community members here, both November, December.
I would like to join if I can, just
Sure.
since I chair the policy council, would like to.
Sure. And we'll start working on that. Any further conversation? Would anybody like to make a motion to adjourn?
I'll make that motion since I've got to jump on another meeting.
We got a,
Second it?
all right. All those in favor of adjourning?
Aye.
Anybody
Thank
opposed?
you all.
I should have closed. Just to- Thank you.
Bye.
Aye.
Get online. I'm gonna take, have only 5 days off, I'm gonna take another 5 days. We'll how the feeling goes. My son's graduating from grad school.
So is it just gonna be focused on kind of this is under the housing
Housing.
and social connections
Yes.
and